The lump sum death payment from the Social Security Administration. It's kind of an embarrassing thing. I worked at the Social Security Administration. I ran the third busiest Social Security office in the country. And before I was the manager of the office, I actually took claims for survivor benefits, spouse benefits, disability, and all the rest of it. And as part of survivor benefits, there is a benefit out there called a lump sum death payment, which is $255. It's been the same since 1954. I've issued tens of thousands of those for $255 for a lump sum death payment for the loss of a loved one to cover their burial. It's embarrassing, but there's a movement out there. There are some politicians out there that want to change that finally after 70 years. So let's talk about that today. And this is also a live Q&A. So I see a bunch of questions there already. So if you have any questions on all things Social Security, let's make sure your benefit amount is right. Let's make sure if you're about to file that you're making the right decision. Social Security is not forgiving. If you make the wrong decision at the wrong time, you could definitely lose money for the rest of your life. So let's make sure you're doing everything right. So make sure you type your questions down in the live chat there. All right, you can tell this is definitely live. This is not edited. So let's get right into it. All right, so this lump sum death payment, they're talking about raising it to $2,900. So there are three politicians that have proposed a bill. It's called the Social Security Survivor Benefits Equity Act. Always a nice long name for everything out there in politics. And to raise it to $2,900, which is, I think, it's a lot better than $255. In the 1950s, a average funeral was about $700. So $255 covered almost half of that. Today, a median cost of a funeral with casket and burial is about $8,300. If you decide to go for the cremation, it's still $6,280 average nationwide. So $255 every time I handed that money out and said, okay, you're going to get survivor benefits, and because you're at least 60 years old and your loved one just passed, we're going to increase your Social Security monthly benefits to this amount. And also, there's going to be a $255 lump sum death benefit. And they always say, well, that's barely covers the flowers for the funeral. And I say, yes, I understand. Hopefully one day that changes. And I guess hopefully this is that day if we support it. So make sure you reach out to your politicians in your local area and say, hey, there is a Social Security Survivor Benefits Equity Act that is about to be passed. Please support it. And so then they're also talking about tying this to COLA. So basically the COLA, like this year, there's 3.2%. We're about to find out what the COLA is for 2025. When that's announced, I'll announce it as well, but also get into the details of what exactly that involves. So make sure you subscribe, and that way I'll keep you up to date on all of the changes for COLA. And since we're coming very, very close to the end of the Social Security Trust Fund, big decisions need to be made, and I'll keep you updated on all of that kind of call to action in some respects. So the COLA is going to be tied to that. So next year, 3%, 4%. So if the 2,900 is tied to the COLA, that will also increase a little bit every year as well, which I think is a good system. All right, so let's switch it from 255 to 2,900. But also, I want to talk about those survivor benefits overall. So if you're the surviving spouse and you are not at least 60 years old, then you don't get the monthly benefits. You just get the $255 and that's it. But if you are the surviving spouse and you're already on the record, that is, you have been collecting benefits from that person's record, as a living spouse, you have to be 62. But if you're receiving benefits from that person's record, what happens is you basically don't have to do anything. When Social Security is notified of that person's passing, Social Security automatically converts your benefits from a living spouse up to 50% to a surviving spouse up to 100%. That's 100% automatic. So it looks at the record, it looks at the deceased spouse's record, and it sees if anybody else is on the record. And if there are, they automatically switch it. If the addresses are the same, then they also issue that $255. So watch out for that as well. Sometimes they miss the 255 because the address is a little bit different. So that's an automatic conversion. And in terms of the last check, so if the deceased spouse has to be alive the entire month. So if the person passes away at the end of the month, the last day of the month, they don't get that check because they have to be alive every single day till midnight that night in order to get that last check. So if you're not entitled to that check, so say if it's October and they pass away October 31st at 11:58 at night, then they weren't unfortunately alive during the entire month. So the October check, which comes in November, they will not be entitled to that November check. So what happens is when the automatic notification of that person's passing is passed on to Social Security and the Department of Treasury, the Department of Treasury automatically goes into the direct deposit wherever that, the bank, and pulls that money out. So a lot of people say, hey, I got the last check, and why was it withdrawn from the Department of Treasury? Well, the person wasn't alive the entire month. That's essentially why they pay benefits 1 month late when you first start on Social Security, is to catch it at the end. And yes, we all have an inevitable end. If you are not on that person's record, then you will have to actually file a claim. So you call up Social Security, call the 800 number, and schedule a claim to go ahead and take a survivor claim to go ahead and get those benefits. You have to be at least 60 years old, unless you are disabled. If you are disabled, it's called the Disabled Widows Benefits, DWB. So a disabled widow can get benefits starting at 50 to 60 years old. A lot of people miss that and miss benefits. So that's why I am doing all these videos. So get the word out there so people get what they're entitled to. So that's why I need your help by sharing and subscribing and liking and all that kind of good stuff. So this goes out to more people, and more people get what they paid for. All right. So I just wanted to talk about that. And now let's get into actual questions here. On anything. It doesn't necessarily have to be about survivor benefits or the lump sum. You could ask questions about spouse benefits, disability, Medicare. Medicare is a big one right now. The new AEP, the annual enrollment period, is upon us. The new plans are out October 1st. I'm getting calls every single day. Oh my gosh, they've downgraded my plan. They canceled my plan. They're going to be charging me so much more for my drugs next year, so much more for hospital next year. I lost my doctor. A lot of people are getting that, so they're needing help. So that's one of the reasons I put some help together. So if you need help, make sure you click on that little QR code at the top left or right or wherever it is. And you can request help, the one-on-one help, and we can have someone reach out to you, or you can call that number there or email me, and we'll find someone to help you out. And it's 100% free. Check your plan, see what's available for next year, and find you something better. All right, so let's see. A lot of people say hello, Ed. Hello, hey, how y'all doing? That's so terrible. When my husband died, minimal cost for $4,000. Yeah, it's $255. So we definitely need to change that. I'm afraid that it sounds like I'm sure everybody here is good with that being finally raised after 70 years. I see one industry that's not, and I help people. I have a team partners that help people with exactly that, burial insurance. So if you don't have some money in the bank or wherewithal to pay for the funeral when that event happens, a lot of people can't afford it. So they get burial insurance, pay a little bit every month in case something like that happens. I'm sure the burial insurance industry will be completely against this bill. So I think it should pass. And then, sorry, burial insurance people that help people out, including the people that help my people out. Sorry, but I think, yeah, come on, 70 years, that's just too long for to stay at one price. So anyway, is there any expiration to claiming burial payment? He died 2000. Yes, it's 2 years, unfortunately, but there's so many exceptions. But 2000, yeah, if he passed away in 2000, you didn't collect the 255, then yeah, that's probably. So sometimes they can do an exception that, you'd called, several months ago and you were given the wrong information or something, but generally it's 2 years. The extra military money is added to PIA, part of spouse's benefits. Yeah, so what is talking about is if you served in the military, they give you a little bit extra in terms of your earnings for those particular years, and that's added to your primary insurance amount, your benefit at your full retirement age, and your spouse, if your spouse collects benefits on your record, they collect benefits pay, your primary insurance amount, the amount at your full retirement age. So yes, if your benefit amount increases because of that military credit, then your spouses will increase as well. Absolutely. Um, if it passes, can it be retro payment? Yeah, I don't think. Yeah, Congress can do whatever they want. If they make a law on it, they could they could very well do it. I don't think. I'm trying to. I don't think there's anything in there. They're talking about maybe 2025 that would take effect. So I don't think anything in there for retro. So my wife was killed in an accident in 1997. Wow, sorry to hear that. I was married to her for 2 years. I am receiving benefits now. Can I add to that with collecting off her Social Security? Um, so Charles, this is a good example of a lot of people misunderstand the marriage thing and benefits. So I'm going to use you as an example, Charles. Charles was married to his wife for 2 years, and she passed away while he was married to her. So therefore, he's entitled to survivor benefits. There's a lot of people out there that are entitled to benefits, survivor benefits, but they hear this 10-year marriage thing. So that's only if you were divorced. If you were married and divorced to a person, you had to be married to that person for 10 years in order to be entitled to survivor benefits. But if you were married to the person when they passed away, you just had to be married for 9 months. And there's exceptions. As I say all the time in my videos, there's exceptions to the exceptions. The exceptions are if it died in an accident. So Charles could have been married to his wife for 6 months and still be entitled to survivor benefits, or if that person died in the line of duty while they're active duty military. So thank you, Charles, and for letting me use you as an example there to help other people out that are missing money. So for 2 years, am I receiving benefits now? Can I add to that with collecting off? Add to that. Not sure what do you mean by add to that. Obviously, hopefully you got the $255 lump sum death benefit. But if you're receiving survivor benefits, um, and you haven't touched your own benefits on your own work record, don't touch it. It will continue to increase until you hit your 70th birthday. And then at your 70th birthday or before then, if your benefits are more than the survivor benefits, then you can switch to your benefits on your own record. So if you're currently receiving, let's say, $2,000 from survivor benefits, and then at 68 years old, yours is 2,200, you might just want to, hey, I need that extra $200, and you jump over into your own. But it stops increasing based on waiting to 70. The month you turn 70, that's when it maxes out. So Cheryl, hello. I was told today that I only had 60 days to appeal when I requested back pay for SSDI. 2002 denied, 2008 approved. I cannot file back payback. It's too late. Yes, you have 60 days. They also give you kind of a buffer of 5 days, but sounds like we're talking years here. So yeah, for an appeal, 65 days. But you can file what's an SSA 795 or just write on a piece of paper. If you know that many years ago, we're talking maybe 10 years ago. But if it was several months late or several weeks late, I always say try it, and you submit the appeal, and then you submit a little form. You just write a little thing, and it's called a good cause statement. I worked in the appeals section. I've done this thousands of times, and people, write a good cause statement. They say, well, the reason I couldn't make it in 60 or 65 days is because of I didn't get the mail. I didn't, I was in the hospital, whatever the case may be. And I think I approved every single one of those. I never denied a good cause statement. If it was, 10 years ago, then I never got one for 10 years. But it was mostly, hey, I missed it by a few weeks or a few days or a month or two. I always approve those. So, but yeah, for that long, 10 years, that's unfortunate. That's why I'm doing these videos. So I'm sorry, Cheryl. I should have done these videos 10 years ago so you would have gotten your benefit. So it's my fault. I'm 10 years late, but we're here now. Layla, was I supposed to get my mom's burial money automatically because her SSI never sent it to us? Just curious. So SSI, you don't get if you have someone receive an SSI, and you're probably talking about regular Social Security, not SSI, but I'm assuming. All right. SSI is the welfare-based benefit. If you have someone receiving just SSI, they don't get a lump sum because they're not entitled to Social Security. They're just getting the welfare type benefit. But the benefit, the lump sum death benefit, only goes to surviving spouses that were married to them or children that were receiving benefits on that record. So I've had this happen several times where the surviving spouse is not receiving benefits, but there are children. So this is crazy. I've had cases where there were 3 children receiving benefits off the deceased father, and they're entitled to lump sum death payment of $255. So I had to divide the $255 by 3 children and give each child part of that $255. But yes, Layla, you can only get it if you were receiving benefits from your mother's record. My son is about to receive small amount of his military pay. Dad passed. Will he lose his Social Security? No, military. If we're talking just regular Social Security, if you're talking about SSI, the welfare-based program, then yeah, any type of money coming in, they have to know about it. But if he's receiving, retirement or SSDI or anything like that, then no, military doesn't affect it whatsoever. Only if he's receiving the welfare-based SSI. Robin, what's up, Robin? My husband gets more on Social Security than I do. How do I get what he's getting? Sorry about the blunt wording. No problem. No, you're perfect. His benefit amount has to be twice yours. So his full benefit amount, not what he's receiving, but his full benefit amount. And then you have to file for benefits on your record. So if you've already filed, and when you filed, they ask you, are you currently married? And you say yes. And then they should have seen whether there was any more money. But maybe they dropped the ball or whatever the case may be. So if it looks like his benefit amount is twice yours, then I would call and get your spouse benefits. Charles, the benefits I receive are only mine, and I did remarry. However, I did divorce. Okay. All right. Let's see. Jacqueline, I had my husband applied for retirement benefits on 7/21 online. He has not received an answer yet. Wow. No additional info has been requested. Call Social Security twice. They just said any day now. Any advice? Yeah, that's way, way too long. But one good thing is if you applied and he is eligible, entitled to benefits starting July, and they push the button now and they start your benefits, finally get around to pushing the button and adjudicate your claim this month, then they will pay you the back pay. So you're not losing anything. But y'all want your check. So did you call the local office or did you call the 800 number? So I would, most people call the local office because that's where the claim is taken, but you call the 800 number and they'll be able to look at the claim remotely there and tell you what's going on. So if your husband applied for retirement benefits and he's a US citizen and his birth certificate or his date of birth and everything's correct, they don't even need a a birth certificate anymore. They changed that regulation a few years ago. So yeah, I would call the 800 number 772-1213 and say, hey, what the heck's going on? But Social Security is at a 50-year low in terms of staffing. And that's exactly what politicians want, because they want to deteriorate customer service. So y'all just raise up your hands and say, forget about it. Okay, whatever, give it everything to Wall Street. And that's their plan. So anyway, so my friend Amy is asking, all right, good. I like this, helping other people. I started Social Security benefits at 65 and not working. I'm 67 now and thinking about working again. How much can I make before Social Security dings my check? If you're 67, you can make, let's say, $1 billion. I got to do it like Austin Powers. $1 billion. Yeah. Once you're full retirement age, you can make as much money as you possibly can, and it doesn't affect your Social Security benefit or not, or at all. It doesn't matter whether you're receiving retirement benefits or spouse benefits or survivor benefits or disability benefits. Doesn't affect your benefits at all, unless, of course, you're receiving SSI, which is the welfare-based program. But nope, doesn't affect it. Because if she was on disability, she's automatically switched to retirement benefits, full retirement benefits, and there's no earnings limit after you hit your full retirement age. So $1 billion. For 2025 Medicare smoothing of $2,000 max out of pocket for prescriptions. Do patients have to apply for this payment plan in advance? Are there any forms prescribers will need to fill out for them? Good question, Take and Took. Always good questions. Yeah, so this is a new thing that started, the Inflation Reduction Act. They reduced the max out of pocket for prescription drugs from $8,000 to $2,000. Okay, but even at that number, usually if people have very expensive medications, they have to pay, $20,000 for that, but it's, okay, it's normally $20,000, so I have to pay $2,000, but I have to pay that $2,000 in the first month or the 2 months. So I can't come up with $2,000 in 1 month or 2 months. So part of the change signed by the president is, okay, we'll smooth it over that $2,000. So rather than coming up with $2,000 in January, a little bit every month. So what you do is you contact your prescription drug company that you choose, and they set you up. If you're in a Medicare Advantage plan, which most of those include prescription drug plans, then you just contact your Medicare Advantage plan and you say, hey, smooth me, I guess, right? So, and if you want to review your Medicare plan for next year, make sure you click that little QR code, and we'll have one of our partners reach out to you and help you out. Becky, I filed at 62 on my work history. When my husband retires in 2025, full retirement age, will mine be raised to half of what his is at full retirement age? I get 1,000 on mine now. It depends how old you are. It will raise to up to half. If you're your full retirement age when he starts his benefits, then you'll get exactly 50%. So his has to be, yeah. So his has to be over $2,000. Well, you get $1,000 now, so you start at 62, so that's a 30% reduction. So your benefit amount is probably $1,400. So his has to be over $3,000 or 26, 28. So so when he files, the quickest way to do it is when he files, tell him, when you schedule an appointment, say, hey, my spouse wants to file too, and they'll check the PIAs, his PIA, your PIA, and they'll tell you whether there's any more money for a spouse claim there. Robin, I'm so glad I stumbled onto this. Dr. Ed, I've gotten so much important information. I have sent this to my family and friends. Awesome. There we go. I like it. Yeah, there's I really hate seeing I wish I would have known this a year ago. I lost so much money, or 5 years ago, or the previous person 10 years ago. Yeah. So Social Security really needs to step up. Medicare needs to step up. Medicaid needs to step up and get the information out there. But until they do, you're stuck with me. Max, 135. How long does it take on average for the processing center to recalculate SSDI after the earnings statement is corrected? Again, 50-year low in terms of staffing. So Yeah, if you're receiving SSDI or retirement or anything, and you find an error in the earnings record, um, there's money in the suspense file is what they call it. The Social Security employee at the local office does a 2.8, and he does all the internal sausage making stuff that they have to do, which I've done way too many times. And then the processing center, once the action is made and those earnings are posted to your record, then everything is 100% automatic. So you might receive a letter that it was increased, but it might not increase if it's already at the max or whatever the case may be. But go into your ssa.gov account and see if those earnings are posted. If they're posted, then everything after that is automatic. But in terms of the processing center or the OIO, which also does earnings back in Baltimore, they're way too slow. However, same thing as I mentioned to the previous person. Once they do it, if your earnings that you found were for 1985 and you've been receiving benefits for the past 5 years, and then you get that corrected, they will give you that 5 years of retro pay. So like, oh, we should have given you $5 more for the past 2 years. They'll give you that $5 more for the past 2 years. So it'll be retroactive. But you need your money now. So super long story short, it takes a while, unfortunately. There is no way to die on a date in a month where you could be alive the whole month. What a dumb. Well, you could pass away the day of the next month. So if you pass away on October 31st, then you don't get October 31st. But if you pass away November 1st, you get October 31st. You get October. So that's what that is. And it's one of the other strange things. If you're 62 years old, they consider you you're not. You have to be 62 the entire month. So if you turn 62, October 15th, you can't start your benefits in October. You have to wait until November because you have to be 62 the entire month. So, and there's another strange exception section. They consider you obtaining the age the day before. So if you were born on November 1st, they consider you obtaining that age the day before. So yeah, the whole thing is very, very crazy. Mary, my first and second husbands are deceased. Can I collect survivor benefits on first husband? I make more than my second husband from Social Security, married to the first 17 years. Yeah, you get whichever benefits is the most. So when you file for benefits, survivor benefits, you have to be 60 years old, and obviously there's the annual earnings limit. I did a video on that yesterday. If you're entitled to those benefits, Social Security employee will look at both records and see which one has the most. And if the first one has the most, they'll file a claim on that one. If the second one has the most, they'll file a claim on that one. Let's see, Trissus Duler. Yeah, the penalty is 1% of the national base. Okay, so someone in Barry is talking about the penalty if you don't sign up for Part D when you're supposed to. It's a 1% penalty for every month you did not sign up for Part D when you're entitled, when you were supposed to. Same thing with Part B, except it's 10% for every 12 months. And a lot of people, unfortunately, don't sign up for Part D when they're supposed to. If you get a Medicare Advantage, most of those include Part D in them already. But what happens is people get a Medicare supplement plan, a Plan N or a Plan G. And if you get that, then you have to sign up for prescription drug plan, the Part D, separately. And what happens often is, they sign up for, Part N or Part G at 65. And then the agent or broker says, okay, now we need to sign you up for Part D. And the person says, I don't take drugs, I don't need it. And the agent broker doesn't do their job by saying, they just say, okay, bye, because I don't make any money getting you the Part D, or I only make $10 or whatever. And they just let it go, and that person is penalized. So what they should say is, okay, I understand you don't take drugs now, but if you don't sign up now, you're going to be penalized for the rest of your life. And why is that? Well, insurance is insurance is insurance. Why do you have to pay car insurance if you're not going to have an accident this month? So, because someone invariably is having an accident this month and you're paying for it. So that's pooled risk. All right. What is the new cost of Plan B, Part B of Medicare? We don't know for 100% for certain yet. I've seen numbers about 185 or something like that, but yeah, we don't know 100% for certain yet. Once it comes out, then I'm going to do a video on all the numbers, and I'll give you the numbers, which you already know, but I'm going to give you the inside scoop of how to take advantage of those numbers. Charles, I'm receiving my benefits now. I was asking, can I receive more? I'm 73 and have been receiving since 66. Yeah. So receiving your benefits now, if you were married to anybody that passed away, any survivor benefits there, that will increase your benefits. Um, if you continue to work, that will increase your benefits. COLA will increase your benefits. Can you make sense of this? All right, let's try. Had to sign up for Part B to do X's retirement. Okay, so your ex stopped working and stopped receiving health insurance from that work. So you had to go in Part B. Okay, got that. Got notice they are taking 325.70 for September check, but then October, November, December they're only taking 151. Doesn't add up to Part B. Yeah, that doesn't. Yeah, because Part B is $174.70. So those numbers don't sound correct. So I would reach out and find out what the heck that is. It's not an overpayment, is it? Doesn't sound like even overpayment money. Maybe they're taking out 2 months or yeah, but even then it's not 174 times 2. So yeah, those numbers don't make sense. So you have to reach out to Social Security and say, hey, what's going on there? What are these strange numbers? I am 70, disability, senior, no income benefits, divorced, daughter disappeared, no Medicare, only Medi-Cal. Yeah, so it's on Medi-Cal, so that sounds like you're probably in California because they call Medicaid Medi-Cal in California. So one thing you could possibly do is, one thing is I did, let me pop this up here. I did a video, this one on the bottom, how to live on Social Security alone. And it outlines very quickly about close to 50 different programs. So watch that video. You just go onto my YouTube channel, click on the video thing, and it's probably like the 7th or 8th, 9th down on the list, and watch that video. And hopefully there's something in there that will make your life easier. I don't think the 2025 Medicare payment has been determined yet. Yeah, no. So yeah, we don't know what that is yet. I buried my father who was 79 in 1995. I can't recall if mom received a lump sum death payment. They live separately. So yeah, if they live separately, you have to be living in the same home because that $255 death benefit is supposed to go for the burial. But if you're not living together, um, you know, if you're married and you just, snowbird type thing, then they usually release it. But if you're completely not have different addresses and because you're, separated or whatever, then yeah, they usually don't give out the 255 at that time. I retired at 62. My husband hasn't started his yet. Do I have to wait on the bump up until he starts his? Yes. For spouse benefits for current spouse, you have to wait until he files. So as soon as he files, then you tell him to hand me the phone so I can get money on your record. Anthony, what if your spouse was married previously, married for 10 or more years and die? Would the surviving spouse be able to get survivor benefits or the ex that was married for 10 years? Yeah, either, both. One doesn't preclude the other. You've got people that were married to one person, you've got a person that passed away and they were married 3 times and each of them were 10 years, or maybe the last one was only, a few months and they died in an accident. So you could have 2, 3, 4, 5 people collecting benefits on one record and one doesn't affect the other. So they all get the same exact amount. Unless, unless they were started receiving benefits early. So, but they get the same, the base amount is the same. How much they get is depending on how old they are when they file. Let's see here. Joseph, when I applied for normal Social Security, the application never asked about military time. Is it automatically added? It is approved, but pending because I asked for November start date. Yeah, they're supposed to ask if you ever served in the military, and I don't think they've changed the application recently. But yeah, once your benefit is approved and your what we call the MBR, the Master Beneficiary Record, is set up in the system in November, yeah, I'd call the 800 number and say, "Hey, did you include my military time in there? I just kind of, wondering." If you earned millions, doesn't it affect the Medicare premium cost? Yes, yes. So it doesn't affect your Social Security, but yes, it does affect your Medicare premium. If you're single, you made over $103,000 2 years ago, it increases your Medicare premium. If you're married and made over $206,000 2 years ago, it increases your Medicare premium. So it's called IRMA, income um, related monthly adjustment amount. Julie, spouse died 4 years later. I became disabled. $900. 2 years later, got SB 2200. I can't marry or lose 1500, as I've heard you say after full Social Security age. The DIS SI1 check. Can I marry? Wow. Yeah. Sorry, I can't really follow that very well. But if you're receiving benefits, and the only time you can remarry is if you're receiving survivor benefits and you remarry after 60 years old. So maybe that's what you're asking. What is FRA for someone born in 1954? Um, do I have? Yeah, you can. Let's see if I have it somewhere here. FRA chart. There it is, right there. 1954, 66 years old. So there is full retirement age. So anybody born after 1960 is 67 years old. All right, let's see. Can I work if I start getting my widow disability at age 60? Yes, but your work is limited. Make sure, and working while disabled, there's a lot of limitations. There's a lot of ability to work, but there's also a lot of limitations. You want to make sure you don't get overpaid and get in trouble with Social Security and get your benefits stopped and all that. So I did 2 videos on that. The one is for if you're receiving SSDI, just regular Social Security disability, and the bottom one is SSI, the Supplemental Security Income and Working. So make sure you watch those videos. You can find those under the live on YouTube there. All right. I am the person that my wife was killed in the accident in 1997. Can I add to my benefit using her Social Security? I have made more money than she did. I did remarry, however, I did divorce. Yeah. So yes, but if you made more than her, um, then yeah, your benefits would be higher if you're already receiving benefits. Um, so yeah, you wouldn't be able to add if it's lower. If her benefit is higher than yours, then you can definitely file a claim for survivor benefits and get that extra benefits added on. Thank you. How do I prove common law marriage in Texas to apply for spouse benefits? I'm 60. He died May 2024 at 67 years old. He just retired. You're awesome. Many thanks. Yeah, you're welcome. You just apply and let Social Security figure it out. Social Security has their reference. It's called POMS, policy manual. It's over 20,000 pages, but part of that 20,000 pages goes into details in common law marriages for every single state. Some states allow it, some states don't. Some states did at a particular time, and then they changed the law. Social Security has all that, so I wouldn't do anything prep wise. I would just call Social Security, schedule an appointment, and then they will say, "Do you have the marriage certificate and divorce decree?" And you say it was a common law marriage, and they will go through the whole thing and look it up and find out if common law marriage applies to your marriage in that particular state. And if it does, then they will tell you exactly what you need to prove that you were, on the lease or whatever the case may be. They'll tell you exactly what it's needed. When my husband passed last year, I was told I had no benefits under him because while he was living, he was collecting from my benefits because my benefits were higher. Is that right? Yeah. If your benefits are higher, then there's no more money there because yours is the higher amount. Janet, I'll be 65 in 2 months. I know nothing about any of what you're talking about. Help. Also, I have questions about my late husband's Social Security benefits for myself. Who do I talk to? You can click on the little link there, and I do one-on-one consultations. I do charge for those. 99.9% of my help is free, but I do just a few consultations every day, or not every day, but so if you want to do that. Um, but in terms of 65, if you don't have health insurance from work, or your spouse's work and those employers have 20 or more employees, if that doesn't apply to you, then you need to get on Medicare. And you can click on the little link there and click on one-on-one Medicare help, and my Medicare team will help you with the Medicare part. In terms of money, you can apply for benefits on your own record, or if you can look at surviving spouse benefits. You don't have to file for benefits on your own record to start surviving spouse benefits. So you can start surviving spouse benefits now, start getting that, and let yours just increase up until you hit 70 years old. Um, so, and just keep watching my videos. And this is assuming you're not working because there's still work limitations. So this year it's $22,320. If you're making over that, then Social Security is going to hold back $1 for every $2 you go over. Yes, Just Jeff says, thumbs up, everybody, please. Yes. So this information goes out to more people so people get what they want, and what they need, what they paid for, and they don't come back here 2 years from now saying, I wish I would have known that, 2 years ago. And they find out that information because you press like. My birthday is February 26th, and I will be 65. When do I need to sign up for Medicare? You can sign up for Medicare 3 months before. If you're already receiving Social Security benefits, money benefits, you don't have to do anything. Medicare will send you your packet automatically. If you're not receiving Social Security monthly benefits, then you have to sign up for Medicare at 65, unless you have health insurance from current work, yours or your spouse's, and 20 more employees in that plan, and you're happy with it. But yeah, December is fine to go ahead and sign up for that. And then you also need to figure out how you're going to cover all the gaps, because there's a lot of gaps in original Part A and Part B. And you can either Medicare supplement plan or a Medicare Advantage plan. And that's what my team can help you figure out and walk you through everything that's available in your particular area. The Social Security office told me that rental properties and the work that you do with them is not part of your work history. Is that true? Yes. No. Yes. Depends. Is that your job and you have a company that has dozens or hundreds of rental properties out there, and that's your company, and you get a net income from that business and take expenses and have an office and stuff like that, then that's your company and that's your business. But if you just have kind of on your side, that's your pension, basically, that's how you're going to fund your retirement, then no, it doesn't go into your work history. So it really depends how you file that through the IRS. That's between you and the IRS. But if you didn't include that as income like a business and pay FICA taxes, then no, it's not in your work history because you didn't pay FICA taxes on it. Tammy, if you receive Social Security, do you have to tell them when I receive my pension? It depends. You see a common theme here with all things government. It depends. There's exceptions, the exceptions. If your pension is from a government entity, a state, local, city that did not pay into Social Security, then yes, you have to notify them, because that's called a WEP or a GPO, windfall elimination provision, or the government pension offset. But if it's just a private pension for wherever, then no. Actually, I'm going to be doing a video on pensions and Social Security here probably within the next week, because I get this question a lot. So yeah, if you worked for a government entity that did not pay into Social Security, you need to notify Social Security of that pension. If not, then Social Security doesn't care. I'm 63 disabled, unless you're receiving welfare, the SSI, obviously. I'm 63 disabled, and I receive survivor benefits. Will I lose my survivor benefits if I marry? If no, you're 63, you're good. Yep. Um, Congratulations. Charles, thank you for the information. I do appreciate it. You're welcome. How much dollars would I get on widow disability at 60 from my husband? Don't know who he is. Sorry. Primary insurance amount minus basically 30% because you're filing at 60. Stopping work November 3rd. Need to be 62 for 1 month. So that means I won't get first check until second week in January. Be aware. Yes. So you have to be 62 the entire month, number one. So if you turn Halloween, you're not 62 the entire month if you turn 62 Halloween. So your benefits, you can't start your benefits till November, and Social Security always pays a month late. So the November check comes on in December. And because you were born on the 31st, the last part of the month, you'll get your check on the fourth Wednesday of the month in December. Julie, I'm 63. I receive survivor benefits and disability. Okay, all right. I just answered that one. Anne-Marie, thumbs up, folks. Yes, thumbs up, everybody, please, please. Yes, it's partly an ego trip. I like thumbs up and subscribers, and okay, I like a tad bit of ego trip, but it teaches this stupid YouTube algorithm that this information needs to get out to more people. And that's what really makes everybody happy, is people get the information and get a lot of people out there struggling. They need help. So I took early retirement at 62, but continued working part-time. I am 68 now. Will they will they still continue to take $1 for every $2? No. You're past your full retirement age now, so it's yeah, a lot of people mistake that. They say, I heard $1 for every $2 or $1 for every $3. No. Once you hit your full retirement age, you can make $1 billion a month and nothing is withheld from Social Security at all. The IRS, well, if you're making $1 billion a month, then you're probably not going to pay taxes anyway because you've got super expensive lawyers. It's only us schmucks that pay taxes, right? So anyway, with a maximum amount you can make working while an SSDI go up the same as the COLA. Yes, yep, those numbers go up every year. Part B will go up, the IRMA thing will go up, COLA will go up, substantial gainful activity will go up, the trial work period threshold will go up. Yeah, everything pretty much goes up every year. Ed, did you receive your YouTube silver play button? Yes, I did. Yes, yes. Anyway, so, but yeah, that's nice. But it's much more nicer to see how we help people out there, and that they're getting their money. I'm 62. My spouse is 67. If I start my reduced age 62 benefit, will my spouse receive 50% of my PIA or 50% of my reduced benefit? Good question. Sergio Santana. We actually took the application for Carlos Santana in my office. I got a lot of famous people in my office. My old office that I used to run. Again, I'm not currently a Social Security employee. Good question, because no, it's based on the primary insurance amount, not the reduced benefit. So the spouse gets reduced based on if they file early, not whether you file early. So if you're the higher earning spouse filed at 62, the other spouse's benefit amount is not based on that. It's based on how much that person would have received at their full retirement age, which is also called the PIA, the primary insurance amount. Ray, I was determined eligible today for SSI, Supplemental Security Income. Good, congratulations. I know it will affect SNAP benefits, but does it affect QMB benefits from social services? No, usually none of that does. So you have SSI, and you have Medicaid, QMB. QMB is the qualified Medicare beneficiary. You have one of the highest levels of Medicaid there. It shouldn't. SNAP benefits depends on your particular state. Some states are kind of cheap and they count that. Other states not necessarily so. But yeah, so if you have, but that's SSI, so that means you're not entitled to SSDI at all. So you're not going to receive Medicare, but maybe you could reach out to Medicaid and ask if they will pay for your Medicare Part A and Part B. Sometimes states like to do that because it saves them money. And if that's the case, then you can get some more money by getting one of those Medicare Advantage dual eligible plans. Those are the ones that you see advertised all the time with all the extra grocery card money and over-the-counter money and stuff like that. They do exist. They are definitely advertised kind of in a scam type manner, but they do exist. I am making $930 right now a month and about $100 a month on eBay while waiting to get approved for SSDI. So I need to tell them my income every month. I am making $930 right now. No, you're under the SGA, which is this year is $1,550. So no, you're goodish. I'm sure you already told them that when you filed, but as long as you're under the substantial gainful activity, and the reason you're under the substantial gainful activity is because your disability is, preventing you from working full time and making more money, and so that's why disability is there. But yeah, you should be good there. Hi again, this is Janet. Hey, Janet again. I'm still working 32 hours weekly, mostly some was less. I did go on the QR code, was still confused, but we'll try again. How can I possibly catch your free call time? Yeah, this is the free right here. Ask your question here. My private consultations, I charge for that to pay for the, rent and the phones and all this other kind of overhead. But if you've got a question, this is where you ask it. Cadillac Jack, where you been, man? How you doing? Great to see you sharing your years of Social Security knowledge. Hey, Cadillac Jack. Lori, I think Social Security should be paying you for doing this every night. Look how many people are learning from you. Would save them phone calls from confused people. Yeah, Social Security. I'm a big supporter of Social Security. I love the organization. I love their mission. The staff that work with me, I'd had like close to 100 employees. They were the best in the country, and Social Security paid me a few decades. So I'm happy with Social Security, and I'm happy you're happy, and I'm happy to give back. I'm going to keep doing this until all my hair falls out, which might be another week or so, but no, another 20 years, please. Penelope. Oh, Penelope's answer. Yeah, and Penelope always jumps in there and answers questions for other people, and she always is 100% right. So Penelope is awesome. Let's see here. What age do you qualify for Medicare? At 65, unless you're receiving Social Security disability insurance. If you're receiving SSDI, then you get Medicare after being on SSDI for 24 months. Retired from USPS at 60, United States Postal Service at 60, took federal employees' health benefits with me. 65 in August, I signed up for a company, Medical Advantage Overkill to keep FEHB. Some people do because those Medicare Advantage plans are zero premium per month. So some people do, and they get some extra benefits, but some people don't. You've got, plenty of coverage being in federal employee health benefits and all that. So either one is fine. I'm 64. I worked most of my above knee amputee all my life. Can't hardly drive anymore. You think if you're unable to work because of your disability and you're still 64, I would definitely apply for Social Security disability benefits. Even if you're receiving retirement benefits, if you're approved for disability, that might increase your benefit amount for the rest of your life. I received CalPERS and paid Social Security tax when working. Can I collect SSDI for heart disease? Yeah, you can definitely apply. You paid into Social Security, so you also paid, into 5 of the last 10 years. So you are definitely entitled to or insured for benefits. I'm 60, been divorced for 5 years, was married for 28 years. Can I draw from her Social Security? Yes, if your work limitations, you have to be, under the annual earnings limit, $22,320. but I would definitely call Social Security, and you can start your benefits at 60 on survivor benefits. And then when you hit 62, if your benefits are higher, switch over into yours, or just wait because your benefits will continue to increase until you hit 70 years old. So stay on survivor benefits as long as you can and then switch over onto your own. I love the Social Security office that helped my daughter in the 90s. Now she is having some issues. Yeah, that's when Social Security had their staffing was pretty good and didn't have all the baby boomers. Now we've got 11,000 people hitting 65 every single day, and Social Security staffing is so low. I'm 65 and still working. I paid for my health insurance through my job. Do I need to apply for Medicare? No, if you have health insurance from work and your employer has 20 or more employees, it has to be through current work, not a retirement plan or COBRA or anything like that. It has to be through current work. If you have health insurance from current work and they have 20 or more employees in that plan, you do not have to sign up for Medicare. Yeah. Let's see. We got some other questions that popped up here. Ray, I'm on a dual eligible Medicare Medicaid plan. Thanks to your referral to an agent, help me. So once again, will my eligibility determination today affect my QMB benefit? It really depends on your particular state. You have to make sure you notify your state Medicaid office that you have new money coming in. That's when you sign up for Medicaid, that's the promise you made to them that if you hit the lottery and make $1 million, you will notify them. If you get approved for SSI, you will notify them. And the Social Security system talks to most of the Medicaid systems like that. Takes forever. So they will find out. And what happens is, they won't know until, next month or 3 months down the line. And then it'll take them, another 2 months. And all that time you might be overpaid for 6 months. And then they'll send you a nastygram saying, hey, you shouldn't receive this for the past 6 months, pay us all that money back. So to prevent that, you do what you promised to do it the first time, is call them up and say, hey, by the way, I just got proof for SSI, and they'll ask you how much it is and all that kind of stuff. But if you're just receiving SSI, you should still continue to get QMB. I don't think there's any states that are that cheap. Yeah, let us know whether your state is that cheap, and they did. They might downgrade you from QMB to like a QI or a SLMB, but which is a lower level of Medicaid. But yeah, I don't think they'll kick you off of Medicaid completely. Jerry, I have been a stay-at-home dad and didn't work enough to earn the 14 points needed for Social Security. It's actually 40 credits. Been married for 55 years. I'm 69. Is there anything available for me at all? Yeah, as soon as your spouse, sounds like you're still married. As soon as your spouse starts collecting benefits on her record, then you can file for a spouse claim on that. You don't have to be insured for benefits on your own record at all. So you just start collecting spouse benefits. All right, let's see here. If you have less than 35 years employment, when does Social Security readjust your new income if receiving Social Security currently? If you have less than 35 years, then, again, that's how Social Security determines your benefit amount, by your high 35 years. But if you only had 34 years, then they take 34 years plus a 0 year, and that 0 year brings your calculation down there a bit. If you continue to work and replace that 0 year, they automatically recalculate it. So once you file your taxes and pay your FICA taxes, then the IRS notifies Social Security, and Social Security adds that money to one of your high 35 years. They kick out the low one and add that money and recalculate, and that's 100% automatic. Let's see. All right, we're running out of time. Let's do one or two more. Currently on SSDI, started working under the trial back to work program. What happens if I work longer than the 9 months allowed? Then you will go into your extended period of eligibility, which is a 36-month period. So any month that you go over the substantial gainful activity, you're not entitled to that month of pay. And make sure you watch my video on that, and then make sure you reach out to Social Security. Usually there's that trial work period, 9 months, and then they kind of give you a kind of a gray area ish, but you're supposed to be kind of almost immediately switched from that 9 month to the 36 month of the extended period of eligibility. So, all right, let's do one more from someone I don't recognize. Let's see here. Some new people here. I was under, if I live with my disabled, decreased parent and cared for them, and would I have been able to get these death benefits? If you are receiving benefits from your parent because you are disabled or you are under the age of 18, then you can get that death benefit. But if you're just a child, yeah, we used to get people that come in the Social Security Administration all the time and says, my parent just passed away, and I'm 35 years old and I've got a job making $100,000, but I want that $255. And it's yeah, sorry, unfortunately not. So if we'll do this last one. If you hit the lotto and we're on SSDI, does that make any difference? You have to come back here and buy me a beer. But other than that, it makes zero difference whatsoever, because you're on SSDI, not SSI. If you're on SSI, yes, because that's a welfare-based program. But if you're on SSDI, unless, okay, this is a question I get all the time about gambling. The lottery tickets, yeah, that's no relevance whatsoever. But people ask me about gambling and SSDI. If you are a professional gambler, you go to the casinos all the time and you're a professional poker player, and that's your job to be a professional poker player, then that's your job, and therefore you're able to work being a professional poker player. But if you have an illegal card game with your buddies and you make $500, then yeah, no, you're good. If you hit the lottery, no problem. If you win at scratchers or put some money in a slot machine, then no, it doesn't affect your SSDI at all. So all right, that'll do it for today. I apologize if I didn't get to your question. I will be back again tomorrow. So cut and paste your question. Join me tomorrow.